Field lecture for chapter 22. These talks about the upper and lower respiratory part of the body. There are different colds that you can get with this. The first one, it's going to be pretty much like it's going to talk about cold, flu, and COVID-19 and how all the symptoms may seem similar, but how they're different as well. With flu, you can get like a flu vaccine for one of the treatments. A lot of times people that do get like the flu vaccine that doesn't have the flu, it causes your body to actually have the flu. I actually had that happen to me a couple years ago. So we'll talk about a lot of the symptoms on when you have like just like a common cold. They gradually come upon you. When you have the flu, it's like sudden, but COVID-19, it gradually comes to you as well. When you have a cold, it doesn't affect like your body heat. It doesn't cause fevers. But if you notice, a lot of times people have sore throat. That would be with cold, flu, and COVID. Shortness of breath is only in COVID. That's why a lot of times people ask you if you're shortness of breath or having like stroke-like symptoms to let them know immediately when you check into like a Med Express or something. COVID-19 pretty much can affect you like vascular. We have seen like a lot of people where I work at that have just got over COVID, that it has messed like with their vision a lot. It has actually caused them to have like a lot of like double vision just because of how it can mess with you, vascular and everything. Because like sometimes COVID, it's almost like a sinus infection, like a sinusitis. But a lot of times you lose your taste and smell. I've had COVID 3 times. The time I had it a year ago, I lost my smell, I lost my taste. When I had it back in March, I didn't lose my smell or taste. It's pretty much, it felt like I did have a sinus infection. There are different types of symptoms. As you see, you sometimes will have sneezing with it, but it's morely headaches. It has to do like with your head. You're drained because it takes a lot out of you. You'll have a lot of coughing as well. There are vaccines that you can take for it, but a lot of times people say when they do take the vaccine, they still end up getting COVID as well. I know when this past time I had it in June, I'm still to this day, I can't wear glasses or sunglasses or anything on my nose because my nose still hurts because there's like so much pressure built up right here due to like COVID-19. I have never had flu A or flu B, but they say flu B is one of the worst ones. It has more symptoms. There are flu shots you can get for that. When you just have like a common cold, there are Dayquil, NyQuil that you can take, and cough drops that will help with the coldness as well. One of the things that we have is the whooping cough. When we talk about whooping cough, this virus pretty much started back in 1926. And how it came upon is there was um, a very small, like gram-negative rod. Um, there, it's just like the way you cough. Um, a lot of times you could tell with this that you have whooping cough. A lot of times you can take, in order to tell if you have symptoms of it, there's like a charcoal agar that you can use to help determine if you have it. Um, you can, one of the treatments that you can do is to make sure that you have your booster up to date, your Tdap up to date. After the age of 11, make sure all that's up to date. But all diagnoses will be different in different people as well. RSV. RSV is more common in infants. That's why a lot of people don't like their baby being kissed, because a lot of people it can be like deadly on babies if they get RSV, because it can cause like your O2 stats to drop. This is more like a fall winter type of season symptom, the way that you can get RSV. It's like a mild common cold, but it's pretty much you can recover from it from like a week to two. There are medicines that they can give you. A lot of times when you have this, some of the symptoms are coughing, decrease in appetite, a fever, sneezing, but your fever is very high when you have this. My son actually had this actually a couple months ago, my 2-year-old, and it it drained him. But I mean, it's gonna drain anybody, but where he's only 2, it affects him more, because where he has asthma, it puts 10 times more stress on you. Um, it's a very, very like horrible outbreak. RSV is. It's very hard to contain it. A lot of kids get it. No matter if you clean, there's still ways that it can get through. Um, the way that this would be transmitted is through like droplets. It's like a droplet contact type of transmission, and it can affect all age groups, but it's mostly seen like in infants and like when you older adults, like 60s or older. This RSV can be like very dangerous as well. Here are some like structures of influenza. It tells you like what the virus attacks. It's very deadly if you leave it unattended. It happens so quickly that people don't have time to react. This is like one of the only viruses that can circulate every year. There are different symptoms for this, for different age groups for this as well. Everybody does not have the same symptoms. And they're very different vaccines that you can give people, like depending like on their age and stuff as well, and how deadly. or how extreme that their sickness is and symptoms are. There are different types of vaccines that we can give. Usually like the incubation time for this influenza is anywhere between 1 to 4 days to where you're not in contact with somebody. Usually some people on set get symptoms, but then again, some people their body doesn't like act quickly to where that the symptoms come automatically. A lot of times you'll have like stuffy nose with this one. Your whole body aches. You'll have like a dry cough as well. You pretty much this can travel like through like your classrooms and like hospital settings because it can go like through the vent settings of this because where it's pretty much airborne. You can clean, but not a lot of times like the vents and stuff get clean. So you sneeze, cough, it's going up in the air and it's going to go somewhere where it's cold. Late fall, early winter is when this picks up. It affects more like in the drier air part of it. And that's what makes the respiratory tract like more weakened whenever you have like drier air. It causes your respiratory tract to like shut down. This is pretty much all the stuff that affects like the upper respiratory tract system. And this is a graph telling you the upper respiratory tract. A lot of times the major structure that it affects, like you'll see, like it affects like your mouth, like your dental stuff as well. There's different types of dental health issues that you can have, like gingivitis. You have like tooth decay as that. A lot of plaque built up in your teeth, a lot of enamel. Your nostrils, your pretty much everything that's right up in here that the upper respiratory tract affects. The lower part, it pretty much is going. You can have black lung, bronchitis that will affect this as well. The trachea, the bronchial list. So this pretty much is going to be part of the lower part, like pretty much in your chest. A lot of times you can get like a chest cold. But if you don't take care of the chest cold, it can actually go into your lungs, and that can cause like a walking pneumonia type of thing. Once you get like walking pneumonia, it pretty much feels like you have like broken ribs because it's hard to breathe, it's hard to walk, it's hard to talk. The way that all like the film and the fluid is just staying like on your chest, it eventually has to have somewhere to go, so it attacks your ribs. So that's why it's called walking pneumonia. And then the upper respiratory tract system is pretty much like a first line defense. The reason that is because the way that your reflexes are, like when you cough, your body's wanting to protect your lungs and stuff. So it's wanting to like react to anything that you're doing. It affects like your nose, your breathing as well. So it's going to want to protect your body from getting any other diseases.